Our first speaker is Mr. Brad Carey, who is the Vice President and General Manager for Cerner, and he's responsible for the business growth and overall financial performance of Cerner's Population Health Organization. Cerner's Population Health Organization consists of 10 business units that have solutions and services that span the continuum of care. Brad joined Cerner in '96, and his prior roles include an interface analyst, an interface architect, engagement executive, client results executive, vice president and general manager of Premier Great Lakes, and a vice president and general manager of Lighthouse. And with that, I will turn it over to Mr. Carey.
Thanks, Scott. All right, good morning. Those in the back, we have lots of chairs up front. If you'd like to sit, I welcome you up front. I see quite a few of you back there. Feel free, come on up. So I assume most of the room is full of Buckeye fans. Boy, that wasn't very impressive. Maybe, there we go. Maybe my school has hope. So I grew up in Michigan, so I'm just going to get that on the table. But I did not go to Wolverine Nation. I went to Sparty Nation. So we share a common enemy there. And I think we both have had some fair amount of, I think you guys have won 10 of the last 11. We've won 7 of the last 8, so we're feeling good these days. I do look forward to the game. I'm expecting we'll both be undefeated come November 21st. And we'll kind of see what happens there. All right. So how many of you, Ajay introduced the book, and there's a theme to the conference, so long, and thanks for all the fish. Has anybody read the book? Anybody know what that's from? Oh, good. So it's for those who don't, it's from the Hitchhiker's Guide to the Galaxy. And it's actually, it was a sci-fi comedy that actually started as a radio broadcast back in 1978, and it has a big cult following. It turned into a trilogy of, I think, 6 books, and then it turned into comic books and a TV series and a big motion picture, etc. If you're interested, because I'm going to make a couple references to this as we go throughout the day, it turns out, I checked before I came down, you can still rent it on Netflix, $2.99. So if you get interested, I'm going to set the stage a little bit on what the premise was. So he made the connection to the data. I'll just say it starts with one of the premises is man thought they were the most intelligent species on the planet. Turns out that they were the 3rd. The 2nd most intelligent species on the planet obviously was dolphins. And this all kind of comes from there. Anybody remember what the most intelligent species was for all those that raised your hand that have seen? Mice, very good. Very good. So the saying, so long and thanks for all the fish, is the dolphins, 2nd most intelligent species on Earth, figured out that the Earth was coming to an end, it was going to get destroyed, and they tried to warn mankind by hitting the little balls when they jump out of the water and all the things the dolphins do. And man didn't listen, they didn't get the clue, so the dolphins took all the fish and they left Earth. And that's kind of how, if you watch the movie, that's actually where the movie starts. So you'll see this little ditty they do. So that's kind of the premise. So some more of this may make more sense if you go watch the video. Remember, Netflix, $2.99. Still renting. All right. All right. So the last thing about the video or the movie and so long and thanks for the fish here to get us started. So those in the room, because you did great, you got the mice. Are you a group to be reckoned with? Now, of course, the Buckeyes would say, of course, we're a group to be reckoned with. But related to the book, who are the people that are to be reckoned with? Anybody remember? Anybody remember as follows? So you have to, the most massively important thing in the Hitchhiker's Guide to the Galaxy is a towel. And if you can hitchhike your way across the galaxy and keep track of your towel, because this is the most useful and practical thing, you are a person to reckon with. And then there's all kinds of things that go along with that. All right, so of course I brought my Sparty towel, but I won't put that in front of you for the whole spiel. All right, so did anybody bring their towel today? No. All right. Now, see, I just gotta say, my wife told me if I did this little bit at the beginning, I was gonna hear crickets, and I feel like I hear crickets. And my wife was right. All right. She was right, so we're gonna move on. All right, so, all right, here we go. Since I was the first speaker of the day of your conference, I figured what I would do really quickly, in about 60 seconds or less, just set the stage on population health, which I think most all of you have this by heart. So we spend a lot of money on healthcare in the US, but we get, you know, depending on the metric, you may get comparable results to maybe South Korea. Okay, we spend 4 times the money, but, you know, depending on which metric you want to look at here, I'm looking at life expectancy. When you get towards the end of life in the US, we max everybody out, 80% of our spend is there, unlike the other developed countries. Where do we spend our money? So these are 2013 numbers. We basically spend them in the 4 walls. Right? Acute care settings, hospitals, some in the clinic, you see 52%. If we're going to be successful in population health, we've got to keep people from getting into the 4 walls, and we got to spend money and effort outside of the 4 walls. Right? It's all about keeping healthy people healthy. If you need care, we want to get you the highest quality care at the most economical price. Okay? So I think that's what we're all trying to achieve on population health. To help speed things along, the government continues to launch programs, right? So you're going to put more and more of your reimbursement at risk, and it keeps, as you see, it starts to get very material, especially here on the Medicaid population as you get out towards 2018. This is just in the U.S., the federal government. Commercial payers, as I'm sure many of you are probably familiar, depending on which market you're in. Actually, in your Ohio market, how many organizations have started to take on risk? GainShare and MSSP, ACO. So only 2 or 3, 4? Okay, very good. How are you doing in those? Are you early? You been in it? Are you having success? But is it going well? Thumbs up, thumbs up? Okay, good. Good. So the risk is moving from the payer to the provider. So it's putting a big constraint on all of you that function in the health systems. And I believe ultimately the risk is going to shift to all of us in the room as members of a community. Okay, so your health systems typically function at a very small margin. That's probably not going to last for very long. Many employers have already gone self-insured. They want to keep pushing risk further and further to the person. And when you have all the decisions to make around your healthcare spend and where you're going to spend your healthcare dollars, we will start buying healthcare services much closer to how you buy a big screen TV or how you rate a restaurant. Okay, meaning you're going to think about cost, quality, service, and convenience. Okay, now we're not there yet. Right now we're shifting from the payers into the providers, but it will eventually shift to the members. All right, so ultimately, I think most of you are familiar with the triple aim. If you take the triple aim concept, we're trying to do that across a community, across some span of geography. As I said, keep the healthy people healthy. If you need care, we want the best quality of care at the most economical price. And as I said, as the shift keeps going to the member and you make your own decisions, if we forget about the patient experience, we're going to be in trouble when it gets there. Right? If you think about it, if you go to a restaurant, they have great food at a reasonable price, but the service is horrible, are you going to go back? Right? So maybe not, right? That starts to become a question. All right, so that's my backdrop. So what's needed to be successful in the population health? And I'm going to do 2 bends here. You have a lot of technology challenges, so I'm going to highlight some of those to give some food for thought on how some of those are being overcome. And then I'm going to do a little bit on behavioral habit forming science. And the reason why I'm going to do a little bit on that after we do technology is, at the end of the day, if we get all this data from all the different pieces, We study it, we create intelligence out of it, we can get it back into the workflow to make a change. You still haven't achieved anything if you haven't gotten Brad to change behavior. And Brad's pretty ingrained as a human being into certain habits. Okay, so I'm just going to touch on that a little bit because I think we need to think with the end in mind that we ultimately got to get to that tougher population and change some habits. All right, so we need to connect the continuum. So this is different venues of care, this is devices, this is things like patients like me. We at our Cerner World headquarters, we have a fitness center. And I could be written, and I probably do because I need to lose a few pounds, a fitness prescription, and all our cardiovascular equipment actually communicates wirelessly up to my record. Okay? We're becoming a very connected world. Okay? This right here, which I would imagine most of you have a smartphone. Not all our generations do, but most of you have a smartphone. These are capable to have a barcode reader. If I had a barcode reader, right, I could scan my groceries into my grocery cart. And I could have that data sent up and actually do decision support and analytics real time off of that, right? So that could be, you know, Brad, put the box of Twinkies back, you should pick up the bag of apples, okay? That technology actually exists today. We haven't connected it yet, but from a technical perspective, it exists today. So we got to get everything connected. That involves normalizing the data, aggregating all the data. We got to be able to make sense, boil it down to a meaningful concept so that we can do something productive with it. And then we need to empower. We need to empower physicians, new care teams, other organizations, me as a member. We need to empower. So it's not, think of empower, it's one part engage, but when I engage, I've got to have the right information at the right time, and it's got to be actionable so I can get the expected outcome. So there was a study by the British Medical Journal a few years back. They did a study that said, if I put a laptop in a physician's office and it has the best predictive model for, well, let's just call it XYZ, how often would the physician actually use that outside of their workflow because they're using system ABC? It's the best predictive model on the planet for XYZ, but I'm over here using ABC. Any guesses? No guesses? 0, exactly. I said, you had the right answer. 0. So it was practically 0. And they actually did the formal study. Why? Because you're breaking the workflow. And that's why we got to get the right information at the right time at the point of decision making. Can't be 30 seconds later, can't be 2 hours later, right? Because we're all too busy. We will have moved on, we missed the opportunity. Okay? So let's take an example of how that may work. So we're all familiar with avoidable readmissions and the big cost it has on the system. So it's about 40 plus billion, right, a year. Avoidable readmissions, 30-day avoidable readmissions. What's the number one reason for that? There's one clear reason that rises to the top. Anybody know? Medication compliance. Do I follow my provider's guidance around how I should take my medications? Okay? So how many of us do follow our physician's guidance around how and when we should take our medications? Any guesses? Was that 5% back here? So it's about 50%. We do it about half the time. And if you take pediatrics out, it actually gets far less. We're really good about making sure our kids get their medications prescribed from their doctor. We're not very good as adults about doing that. How many people don't get their first prescription filled? So forget about like if I got 3 doses or it's a regimen. How many don't even get the first one filled? Very good. 20% don't even get the first one filled. You know these stats left and right. It's good. I'm just going to keep looking at you. You'll be good. So out of that 20%, we'll see if we get the next one. Out of that 20%, how many of those patients, they didn't get the first prescription filled, right? So now we know they're going to be a likely candidate readmitted, have a chronic condition. Okay, we got half. Any other guesses? 80%. 80%. So the ones that need the medications the most aren't even getting the first prescription filled. And then we wonder why do I have $40 billion in avoidable costs? So wouldn't it be great if you could say, if you had a real-time system, and these technologies are evolving, we're going to talk about them in a few slides here, that could actually track, Brad's been prescribed something, maybe I got the first one filled, maybe the provider gave it to me when I left the office, that would be great, make sure I got it. But the system could monitor that I didn't get the second refill filled, and then have it be able to take action. Oh, Brad hasn't, it's been 1 day, it's been 2 days, but let's send a message. What's the best way to communicate with Brad and have this new ecosystem know, oh, well, Brad has a smartphone, send him a text. He has no technology, give him a call. So that you could actually say things like, in my case, I have a smartphone, send me a message that says, Brad, we see that you haven't refilled your metformin prescription or have gotten it refilled timely. On your way home from work, there happens to be a Walmart and a CVS. They both carry it. It's $4 at the one place. It's $7 at the other. Could you please pick it up? And oh, by the way, your wife would really appreciate it if you did. Right? And the last part, I say half jokingly, but this gets to the behavioral science at the end. You actually need to make me do it. I knew I had a refill. So now you push the intelligence to me. Okay, that's a start. Am I going to stop? Now, if I know if I get home, I'm going to get harassed by my wife, who also knows that I got the alert, then maybe I am going to stop, right? Especially since she was right about me getting crickets at the beginning. All right. So facilitate knowledge-driven and continuous learning. So none of this is static. Okay, so it's an ongoing, you guys live this every day, so it's an ongoing learning process. You gotta think of it as a kind of a performance improvement activity. But there's lots of things that can be done if we can get all that data up into kind of one master set. What is are these the students right here? In the red? Yes? All right, I got a question for you. So today in healthcare, how long does it take a new innovation for 50% of the providers to adopt it in practice? Too long. That's a great answer. That's a great answer. Someone should hire him, quick on his feet. Any guesses? Other people in the room, I'm sure, know. The rest of the room? So it's 15 to 17 years. And that's half. So think about that for a second. Someone in this room could create, do we have any physicians in the room? No, okay. Oh, one physician. So let's say the best readmissions predictive model to avoid readmissions is developed today out of this conference. Fantastic. It'll be 15 to 17 years before half of the providers, which means 15 to 17 years before half of us get to benefit from that. So I'm going to go from where I am today to retired, and I got to flip a coin to know whether or not I'm going to have that best logic used to treat me. Okay? We've got to bend that curve. We've got to bend that curve. Okay? And if we can get the data, it hasn't been for a lack of trying. If we can get the data up, aggregated in a meaningful way, we can start using the computer, data scientists, PhDs to create new knowledge. And we can do it quickly, and we can disseminate it quickly. Okay. We at Cerner, working with a few clients, we did a couple of these over the last year. Readmissions, we did one. We worked with Advocate Healthcare on readmissions. We took the latest in the evidence, stuck it up in a real-time big data warehousing platform, which I think you're going to see several of in the marketplace. I don't think Cerner is going to be the only one. And in the first 6 months, with only 6 clients contributing their data, we made 13 new discoveries on how to improve that algorithm. And we were able to make that immediately available out into the marketplace. Okay? We call it assisted machine learning. So the computer's evaluating, it's spitting out recommendations, And then we call it assisted in certain land because we still have our data scientists and PhD statisticians kind of look at what the computer said should change. But that's how fast you could bring innovation to the market. Not 15 to 17 years for half, right? You could really do it in months, if not weeks. So we all need to kind of get there as an industry. Another one I'm really excited about, and you're seeing these, there may even be some of your sponsors may even have some of these types of things. Another one we did that I don't see in the market yet, impactable populations. So where do people start in population health? Highest cost, highest utilizers, you kind of get your pyramid out, right? You go up here, I'm like, all right, I have limited resources, I'm gonna start with some subset of that population. Wouldn't it be great to know within that subset of the population, some of those people we've learned statistically regress to the mean after being a high cost, high utilizer with no interaction, okay? If you knew that, right, you could allocate your resources much better. Now, they don't regress to the mean and stay at the mean forever. So they kind of do this. They go, okay, I didn't need any interaction. I'm back here at average cost. And then maybe 6, 8 weeks out, I start trending back up. Okay, so what you really want to know is get to me before I start trending back up, but I don't need to focus on you in that first, maybe it's 6 to 8 weeks. Okay? The other thing the algorithm does is who has the attributes about them that you have a greater likelihood to make a change, right? So there's some inherent things about us that make us more and more likely to accept changes and recommendations, which also helps you allocate your resources better. And this is just an example of if you start looking at the literature on a real timely basis, you're going to see all kinds of companies producing these kinds of capabilities, which is fantastic because it will help all of you in your roles, all the health systems. We just have to find a way to harness it and be able to get it out in mass. Okay? All right. So we kind of talked about that. We're going to go from reactive care to proactive health. All right, so some of you are probably being somewhat cynical. I see the looks on some of your faces. So you're like, this guy is talking rainbows and unicorns. See, now I see some heads nodding. And I actually had a client I was visiting with, and I was doing a different presentation, had some of the same aspect. Actually, say that phrase to me, Brad, you are talking rainbows and unicorns. So I think there's hope. So let's see if we can level set on some of the challenges. So how many of you feel like this daily? We make it hard on you from a supplier in the industry side. We haven't brought you the capabilities that you need to be much more successful. So we have a burden to bring capabilities much quicker to you in the industry because those price pressures aren't going to slow down. Okay? All right. This is not a master list, but my guess is that some of this would be, from a pure technology perspective, some of these would be on your list. I can't get the data, I can't aggregate it, I can't do something meaningful, I need it available anytime, anywhere, read through the list. I need it to be real time, remember, because we talked about when you got to do the decision support at the time of decision making, right? So you have all these challenges and you have hundreds of systems, they don't talk to each other, they don't talk to each other well, right? Am I missing any big boulder? What'd you say, politics? Did you say politics? Yeah. Yeah. That's subtly in my data blocking. It's a very real one, right? I mean, it is preventing progress in a big way. All right. So I'm going to go over technology challenges and what I see happening in the industry, and then we're going to do a little bit of human behavior. I could not find the potato with the Wolverine hat, but Sparty here is looking good. And that's my Wolverine, who's the couch potato. So we're going to talk about that a little bit later. So for those of you, are the dolphins, so the idea here is, from the book, we don't want the dolphins and the mice to take all our data, and that happens to be the spaceship that you'll see in the movie, for any of those who have actually seen the movie. All right. I do see what I refer to as new age ecosystems evolving in the marketplace. Okay. Cerner's one that has created one of these. It sounded like our The IBM gentleman wasn't able to make it today. IBM is creating one. There's a handful of companies out that are creating what I call new age ecosystems that will do these things. Okay? You will be able to take big data. I can speak from practice at Cerner. We have 3.5 petabytes of data on 55 million people up in our ecosystem. I can process that in less than 2 hours. By the end of the year, I'll be able to process that in less than 2 minutes. By mid next year, I'm going to be less than a minute. The technologies are there, so they're evolving very quickly, so I can get to real time, so that population health isn't just a retrospective activity on claims data. I want all the data, right? And there's lots of data on us. Everybody familiar with the data brokers? Yeah, Axiom and Epsilon and Blue Kai. And so how many data elements does Axiom have on all of us? Probably everyone in this room, because they have data elements on 700 million people. Anybody have a guess? They don't like to share it, so you have to catch it every now and then somebody leaks it. 1,500 data elements. They know what you buy, they know the websites that you go to, they know what you say on your online chat, they know what magazines you're subscribed to, they know how much you're paid, at least an estimate. They know if you've moved, or you're divorced, how many kids you have. It's amazing, all this, and it's ended up in data brokers. And then the data brokers are selling that to different entities who are trying to drive different purposes. You will want some of that data when you start to manage populations. So once we get past, put clinical claims, some patient sat stuff together, some ambulatory stuff, my HIE in the state, all that stuff that people start with, you will likely want my social media, my retail purchases, right? Because you could actually start to predict certain things if you knew, for example, what I buy on my credit card, okay? So I do see these ecosystems coming. Our guests in Cerner, they're really expensive to build. We gotta make them affordable in your health system's hands. So I think the big cost behind it is gonna probably limit us to, I don't know, maybe 3 to 6 in the marketplace over the next 5 years or so. And that'll probably be your choices, whether that's IBM and Cerner and, pick your flavor. There could be some other big entities that kind of enter the market. But you will start to have these kinds of capabilities, and we are moving to one that allows you to innovate. Remember the algorithms I talked about? You're going to see companies like Cerner and others open things up for true interoperability and allow you to create new innovations to be able to use on your populations, so that you don't have to rely on the supplier to create those. All right, I won't spend a lot of time here. Anybody recognize these terms? Some, yes. So most of these big data, cloud-based, system-agnostic platforms are Hadoop-based underneath the covers. When I talked about going from 3.5 petabytes in less than 2 hours at this moment to we'll do it in less than 2 minutes, at the end of the year, and we won't be the only ones, because the magic that's happening there occurs from Kafka and Spark adding to Hadoop. So not that I'll go deep on these technical aspects, but they're giving you the ability to do live streaming and increase the queuing and processing capability. So we will get down to seconds off of big petabytes worth of data, okay? We need it to be usable. I could have put 100 different companies on here. I just picked 2 to make the point. Anybody use Qualcomm's Tunic or Validix? So Qualcomm does home monitoring devices, wireless scales, blood pressure cuffs, glucometers, spirometers, etc. You literally could give a patient, when you discharge them, the devices they need for, say, congestive heart failure. Just pick your disease and decide which ones I want to send them home with. And my mom and dad in their 70s take that as basically the size of a Glade plug-in. No configuration necessary. None. Okay? So my parents, not technologically savvy, they go home, they just plug it in. Okay? It automatically associates to the devices. It'll ask them which one is getting on, so we can associate, but then it's smart enough to kind of know which one is which. And then you can stream all that data up to the platform. Okay? It's gonna have to be that easy, right? Otherwise, we're going to struggle with the adoption and we won't get the change. Validic is really the same concept, only it's all your wearables. Anybody have an Apple Watch on today? Or a Fitbit? Or a Garmin smartwatch? Several of you. So Validic has basically created that same concept on what I kind of refer to as wearables. Okay, so we're going to get very connected. It's going to get very easy. Now we need to figure out how to create knowledge off of that data. All right, so where is it going very quickly? Natural language processing. There are some companies that are doing great things with NLP. How many people are using NLP in the room at your sites? Like 1.5. It's kind of working. It's advancing quickly. We use it to help match patients. We haven't started to go through documents yet, but that's on our list that we're currently working on. There are other companies that are actually doing quite well with it. Genomics, so how much does it cost to fully map your genome today? Anybody? Nobody knows? $10,000 to map your full genome today. Now that's still a lot of money, but it's coming down. When they mapped the first genome, anybody know how much that cost? $3 billion. So we've gone from $3 billion to $10,000 actually fairly quickly. And if you just want to do genotyping, you can get down to the hundreds, maybe 1,000. Okay, but the full genome is at 10K right now. We're going to have systems very quickly that can actually store the full genome, allow you to bake that into your predictive models, and it'll start to become affordable. There's lots of companies racing to get that thing close to $1,000 where everybody could just go in and say, map my full genome. Okay, so that is coming. Longitudinal plans across the community, giving access to whoever you want in your community, churches, counselors, long-term care, etc. Make it open. I'm the patient, it's my data. If I consent that anyone's going to help me with my care, why can't that be open? Why can't everyone see that interacts? World of connected things, which really kind of blows my mind. I was talking to some people at dinner last night. I have 5 kids. They range in age from 21 down to 4. My 4-year-old's he's much more tech savvy than mom and dad are. It's amazing. He can't read, but he can use the computer independently and he can sure use an iPad. And everything's, he has an expectation now, right? This generation is not going to understand that things are not open, interoperable. They're not going to understand that, okay? What amazes me is, anybody have young children, 10 years old or less? Did you ever catch them watching other people play games? Yes. Do you know how much some of those people make that make those videos? Yeah, there's 2 individuals. I'm a big Time magazine reader. There's 2, what's his name, Stampy Cat and Pi Die or whatever their names are. One makes $7 million a year. The other makes $4 million a year. All they do is record videos, and our children are watching them play those videos. I might need a career change. Smart on Fire, emerging technology. Anybody using Smart on Fire? Anybody done a project with Smart on Fire? So Smart's an open-based standards for applications, and Fire is a new evolving HL7 standard. Okay? At CSOHIMSS, there were some showcases of clients, health systems, that have used Smart on Fire. What it essentially lets you do is you could go into any different system, pull their data, write your own app, and then push data back into that system. So this is back to that you could innovate on your own. And this is where I think us in the big supplier box, we're not going to meet every single need. We're going to make our system Smart on Fire compliant. It gives you another avenue to innovate. Okay, we actually we did one a year ago actually, and they showcased it at this past HIMSS in April with Geisinger, with Epic data and Cerner data, and they have recently acquired AtlantiCare, so they have a big Cerner shop, and they have their long existing big Epic shop, showing that you can bring data out of both of those systems. They created a rheumatology application. The commercial arm of Geisinger is called XG. And they created is very slick. They call it Room Pacer, but it's a rheumatology application. And you can actually, we showed, you feed data from both those systems. They could use it as an app, and then they could push it back down into both. Okay, so you're going to start to see a lot more of that in the industry. And then maybe not necessarily all technology, but I put some innovators. So we do an annual Pop Health Summit. in July. One of the speakers we had out this year was the Vice President of Health and Wellness from Walmart. It was very interesting. The audience liked to have him. The audience didn't like to hear what he had to say, but he was very transparent about what Walmart's up to and what the strategy is. So they liked hearing it. They didn't like what they were up to, but they did like hearing it. And is anybody starting to see Walmart encroach on your primary care providers in your markets? So they're coming after them. They're going to do primary care services in the Walmart, and their big pitch is, and he said this to the room, which I thought I was going to have to save him from the room, but he said, health systems, you have it all wrong. The number one priority is the consumer. And the way healthcare works today, the consumer is not number one. And so he was very thoughtful. It was a very good session, but he took some direct shots, and he said, we're going to make it so that you walk into a Walmart, and they're going to have access immediately. They're going to have clear transparency to price, and it's going to be the best price, right? And they're going to be da-da-da-da-da. It's like, it's all about the consumer. Now, they're not trying to hire doctors and whatnot, but they're going to take all that basic primary care stuff, and they're coming after it, okay? It's one of their ways, as you can imagine, to increase in-store sales. And they see a lot of people. Anybody know some of those basic facts about Walmart? So how many people walk through a Walmart door weekly? Do you know?
I don't know.
Oh, you don't know? You raised your hand. I thought you had 140 million people in the U.S. a week. 75% of the U.S. population will go to a Walmart on average twice a month and spend on average 45 minutes a visit. They're doing all the big data stuff what you guys need to do in Pop Health. They're doing it. They're doing it for a different reason, right? They're trying to get you in the store because they get you into the store, and right, there's all kinds of strategies on how they're going to get you to buy more stuff. But that's why they're getting into primary care services. Another reason to go to Walmart. They believe they have a great experience. People like going to Walmart. They're just going to branch out into some of those primary care services and capture some of those dollars. You got IBM Watson. You'll have others. I'll probably miss some. Amazon. I put Amazon up here. They've done things at scale, right? So when you start using big cloud-based big data platforms, they can get backed up by Amazon on an as-needed basis, so you're not having to pay unless you actually use it. So their scale is actually going to start to play a role when you go into these big data platforms, because that may be a way that you get your backup or that you're protected, okay? And they obviously do it at a very large scale. Okay, I'm going to move to human behavior for a little bit, just for a few minutes. Anybody recognize this? Target. And I'm not, if there's anybody work at Target or have family members that work at Target, I'm not picking on Target. I'm going to do the Target example because Target ended up in the New York Times and the Wall Street Journal and a few other publications in 2012, and then it caused a lot of news entities to go drill and investigate what was going on. They are by no means the only one that is doing this. Procter & Gamble's been doing this for a long time. The U.S. Postal Service actually does this today. Okay, and this is big data analytics, predictive models, behavior change. So just to set the background, because this eventually gets us into behavioral change. The reason why they ended up in the paper, I'll start there. The reason why they ended up in the paper was a 17-year-old girl started receiving a direct mailing at her home for things related to having a baby. Coupons off a crib, diapers, unscented lotion, okay? Dad saw it. It's addressed to, I won't say her name, it's addressed to, we'll call her Sally. It's addressed to Sally. Got very upset. Drove down to the Target and said, hey, are you implying, are you trying to encourage, sex with my, my daughter's gonna go have sex because you're sending her baby stuff, what's going on? I'm very upset. Manager at the Target I need to check into this, I'll get back to you. Turns out, a couple days later, the manager at the Target calls, and the father said, I need to apologize. There's been his quote was, there have been some things going on in my house that I was not aware of. She was pregnant, okay? So that's how they ended up in the paper, and all of a sudden all the news outlets, well, okay, what is going on here? Because she wasn't like, she was not showing, so how did Target know? So this is why the investigation started. So once again, they want to increase in-store sales. They hired a statistician who actually goes around and speaks at conferences now. Andrew Pohl is his name, in 2002. Very smart guy. And the marketing department said, hey, people come to Target to get, I'm running late, I gotta get toothpaste, I gotta get a can of Lysol, I gotta get some toilet paper. We gotta figure out how we get them to buy more stuff. And once we kind of cross a certain threshold, then we've got them. But human behavior today says that we go to different stores for different things, right? So they basically, so the short of this is they said, he found some stuff in the data like, when you get married, let me make sure I get these right. When you get married, this is not right. When you get married, you're open to change to buying new coffee. All right, I found that in the data, it was easy enough. If you buy a new house, you're open to change to buy new cereal. And of course, they use these to then direct market you because they know you're open to a change. This last one I think is kind of humorous, although it's logical. If you get divorced, you're open to buying new beer, also at a new location. I mean, statistically, they found that in the data. So, and I think we can all kind of relate to the last one, right? I don't want to run into that person on a regular basis. So they said, all right, that's all good, Andrew, but the gold is in figuring out one of the biggest times to influence a change in retail purchases is when someone's about to have a baby, and they're open to change at the beginning of the second trimester. Okay? Everybody knows when you've had a baby most of the time because there's usually a public record. That's why they knew the girl in the first place. I mean, Target is loading all that from the data brokers. They have all those public records are going into their database. So anyways, they said, Andrew, we got to figure out, we need to know before all the other retailers when they're going to start their second trimester because that's when we want to start marketing to them. Okay, and Target actually has the ability, and they were quoted as saying this, they could send you an individual flyer with your personal coupons on it. You don't know that it's individual to you, right? You may think this is the same one everyone gets. They can actually send it directly to an individual. Okay, so anyways, they basically, the short is they did find there are 25 different products, which they haven't revealed all of them. They mentioned some of them. You start buying cotton balls and unscented soaps, and they kind of revealed a half a dozen of them, and they came up with a pregnancy score. Okay, so they could actually score your 87% chance that this lady is pregnant. Okay, and they could estimate the due date. Once again, I'm not picking on Target, so don't go out and ban Target, but they have all this data today, so they do that. So they know with a great deal of certainty, they could tell when the second trimester starts. So what did they do? Marketing got all excited and said, okay, boom, I send flyers to Sally, get diapers and bibs and buy a crib and do all this stuff. So what did Sally do? Freaked out Sally, right? Because Sally may not even told anyone she was pregnant. Sally may be the only person that knows, and now she's got a flyer that says, why does Target think that I'm pregnant? So, and they literally did that that was bad. So they did the logical thing. They mixed it in with other things. So Sally now gets a direct flyer, marketing flyer, and it'll have those things, but it'll be next to a lawnmower and patio furniture and a few other things. This is literally what they do today. So they mix, because now Sally's not threatened, and here's where the behavioral change comes. So a quick lesson on behavioral change. Everybody familiar with the behavioral science? You have a cue, you have a routine, and then you have a reward. And we do a lot of these subconsciously. So MIT did a study. There are lots of studies out there now. You put the rat, he's got a straight walkway, and then he's got a T. They put the chocolate in the corner. At MIT, they have these little mini operating labs, and they put electrodes on the rat's brain. And what they learned was when the rat's trying to find the chocolate or the cheese that you put in the corner, activity of the brain is really, really high. They really want to get it, right? Gotta find it. I'm scratching, I'm sniffing. Once they figure out where it is, and they repeat it over and over and over and over again, brain activity goes down to basically zilch. Because it's what they call chunking. So you have formed a habit. They knew when they had a little door. The door opens up with a click noise. That was the cue. And once the rat knew, gone, no brain activity. And we all do this every day. We do this every day. Do you think about how you pull out of your driveway? You probably did when you were 16, but you don't think about it anymore. Okay, so we have a lot of these habits. So they had to figure out how to make this habit forming to get Sally now to go make all these purchases. So the habit there was, the cue is, I need to go buy things. So they need to make sure that when they see Sally's buying behavior, when she goes and makes purchases, that's when you got to make sure that the flyer's there. And they actually know this. If they send you one on Friday, you tend to go in the store Sunday. If I send you one, so they actually have all this statistics. So that's the cue. The routine is, and I need to go buy things. I have things to purchase, right? So I start to go into I'm going to look at my flyer, see if there's any coupons for the stuff that I need, and off to the store. The reward in this case was, there's coupons for things that I actually do need, but I wasn't thinking that I needed, so I'm happy, right? So this is all subconscious, and that's the habit forming. So we need, in the population health space, if you start to think about this, we are ultimately going to need some of these, we're going to leverage some of these learnings from other industries to get to the person, I know the right thing to do, you haven't figured out the best way to influence me. Maybe I can't be influenced with financials. A lot of us do financials today, right? Walk so many steps, you can get some dollars off if you're self-employed, off of your health insurance, or contributions to your HRA. So does it apply in health, right? Because you would say, wow, if this works so well, why aren't all of us skinny and fit? Why do I still have more pounds to lose, right? So there's a question mark there. Columbia and Alberta did a study, 256 health insurance plan members, and they put them in two groups, okay? Both groups got the same exercise fitness training or education. They didn't actually train. They said, this is why exercise is good, here are the exercises you should do, et cetera, et cetera. They both got that. One group only got education on the theory of habit forming. So the whole cue, routine, reward, and they challenged them to come up with their own personal cues and rewards. At the end of 4 months, that quickly, group 2 that got the habit forming theory exercised twice as often or more than the first group, right? Because if you make it a habit, then you don't think about it and you just do it. And there's a psychological benefit, because like I have an award. For some people who jog, it's I put my running clothes out next to the bed and my shoes when I go to bed. Or maybe it's if I jog 3 miles this morning, I'm going to treat myself to a cookie this afternoon at break. You got to figure out what actually you respond to. But once you do that and you ingrain the habit, it's very hard to break. So we're going to need to use, I only bring this up, we're going to need to, if we don't do some of this, once we get all the data and the technology working with the challenges you have today, we will still fall short, right? Because you still are going to have to get me as a human being who's got very ingrained habits to change. There'll be other people you can change with less effort. But the hard ones, you're going to need some of the science that other industries have been using, right? This isn't new stuff. Others are using it every day, just in other industries. All right, I'm going to land with a quick example of it really isn't rainbows and unicorns, okay? The technologies are there. We just need to bring them together. Some of the platforms are evolving. Some are available, and they're maturing. This is just a quick example. It's a real-life use case. We happen to be, Cerner happens to be working with Children's Hospital of Orange County in California. And they have a lot of pediatric asthma patients, okay? And the air quality in California can be a little dicey, right? And then when they have fires, it gets even worse, right? So asthmatics are a big deal for Dr. Feaster out there. So I'm just going to quickly fly by this in like less than 2 minutes just to give you a feel. Let's say we have Maria. She's a 9-year-old girl. She lives with asthma. Here's her family members, her care team, etc. All right, that's just a visual indication of air quality index greater than 230 was one of the data elements that fed the predictive model. We have a problem with our pediatric asthmas. For those wondering, air quality is a piece of open source data or open data. The government actually publishes it into a database which you can pull it off. And they do it quite regularly. So we're actually feeding that in to our version of the platform. It's in our predictive model. Boom. Okay, that with some other elements. We have a problem with pediatrics. Maria's at school. We let the school nurse know. We let Maria's parents know. The school nurse, right, if you think through this, calls Maria down to the nurse's office with her iPad and a spirometer hooked to it, takes a breath reading. How are her oxygen levels? She can see, we're in this connected world, so she can see the longitudinal record on Maria. She can get that value. Mom goes out to the portal. This could be any portal. I just took a screenshot of a portal and can see that result because now we're making the data. This is a real-time ecosystem. So mom can see that value is measured. The care coordinator gets a message that we need to engage. Take a look at Maria's longitudinal record, see if she has any care plans, help advise what the next steps are. She can, as I said, she can drill down on her plan. She ultimately sends a message over to the parents that says, you need to schedule an appointment with the breathmobile. So Children's Hospital of Orange County actually has these breathmobiles so that they're out in their communities, so you don't have to get into a physician's office. Okay? So it's a portable clinic kind of concept. So the people at the breathmobile, they can look at their schedule. They see that they need to see Maria. Maria's getting scheduled in. They can see her results because it's all in a longitudinal record. They see Maria. They document what they've done with her. Maria's doctor gets it. The parents get it back. And all this is showing is that we did a single person, but those people in the breathmobile are actually managing the population of pediatrics. So they're proactively managing them. They're getting this real-time intelligence in, and they have an ability to action, right? It's not retrospective. I want to call, and they're going to wait 7 days to get into a physician's office. So it's all very doable. We on the supplier side, we got to bring the technology faster. We got to make it more affordable. These are a little bit of numbers from Dr. Feaster at Children's Hospital of Orange County. So here's a real initiative off of what some of you might have thought was rainbows and unicorns. It's coming. It's new, so I can understand. When we talked about this as HIMSS in April, there were a lot of, I didn't know that those capabilities were available. I didn't know. So it's all very new, but it's coming very fast. So you can see they kind of outfit those breathmobiles at $1 million, but you can kind of see what they're targeting to save. All right, I have landed. So what questions can I answer? This is back to the book. It's not my quote. I think it's, what's the name of the robot? Marvin. Marvin, the depressed robot, I think in the book is the one that made this quote. I'm working really hard to see if you go rent it on Netflix. I'm just trying to pique your interest. All right, are there any questions for me about the industry, technologies, anything about Cerner? Everybody's tired of hearing me talk. Anybody, did people learn something today? It was really just trying to be thought-provoking, give you a little bit of view of the future. It's coming fast. Good, bad. Don't want to see me again. Yes. Yes. Yeah, great question. So if you couldn't hear the question, it was retail does a great job with point system and rewards. It works extremely well with our own population as employees and their dependents. So we've been doing it on our own people for 6 years. So I kind of have a sample set there. So you do certain things, you actually earn hard dollars per se. And it took us a while to figure out how to move the behaviors. Now we have a demographic that, there's a portion of our demographic that is young and healthy. And we have our does anyone want to guess what our number one expense is? Healthcare expense at Cerner? I know there's a lot of non-Cerner clients in here. What's that? Yes. We have a lot of babies. See, I have 5 babies, so we have a lot of babies. This year, so we have found on that population, it works really well. Some of us are not motivated by financials, or the financials are not enough. In fact, with maternity this year, we actually bid the hospitals in Kansas City because we wanted to create a better experience and reduce the costs on our maternity expenses. Does anyone want to guess how big the range was in the hospitals in Kansas City for a normal vaginal birth? Right, so we never get transparency, right? You guys, nobody knows how much this stuff costs, right? Everyone has insurance, and then you may have a copay, and nobody knows what this stuff costs, right? Did you have a guess? $10,000. From the least expensive to the most expensive in our Kansas City area. So we bid it and said, we're going to have some preferred hospitals that we are going to provide extra visits and extra Lamaze classes and prenatal vitamins. We're going to create this great experience, and people are going to get extra things, including cash, to go to one of these two places. And they have just as good outcomes as everybody else, right? But we then negotiated a price so we didn't have all this variation. And it's been working. We haven't completed the year, but I have some people on my team having babies, and they gave up their provider who didn't have practicing rights to go to one of those to go, and some of them did it and even had to drive 40 miles to get to the facility. So we kind of, you got to kind of figure out where's the tipping point. Okay, how many incentives? How good does the experience need to be? Da da da. And dad gets incentives too. If dad goes to the Lamaze classes and he's there at the birth, $500. I mean, we have all these things. We just try to make it a great experience, and at least my handful of team members that have gone through it just rave about it. But it did take a certain amount. There's basically about $2,500 worth of incentives. Okay? We've dabbled in other things, and there's always this kind of tipping point on the financials. So what I would tell you is at least our 6-year experience on, it works across the whole population of Cerner. It works really well on the less than 40 financial incentives have worked really well, which is what I kind of relate to kind of the point reward system. They get different rewards, et cetera. They're all financially related. But very good question. I personally think when the risk shifts to you as members of a community and you're deciding every dollar and you have full transparency, financials will be a big influencer, right? Because you'll start to have things like, oh, if you don't want to participate in the smoking cessation program, then it's going to cost you $5,000 more. I mean, there's going to start to be, right? We're not there yet, but when it shifts, financials, I do think, are going to start to play a role. Today, certain populations. Well, thank you very much. Any other questions? I see the hook coming. He's coming closer. I'm walking this way. I appreciate your time. Thank you.
Thank you so much.
You're welcome.